We are good to start. Mr. Harewood, if you'd like to begin.
Okay. Well, good morning. Bonjour à tous et toutes et bienvenue ce matin. My name is Adrian Harewood from CBC Ottawa News at 6 and also our Ottawa. And it is a delight and a privilege for me to be serving as your moderator this morning. We'd like to begin by honoring the Algonquin and Anishinaabe people on whose traditional unceded territory the city of Ottawa is located. We'd like to extend this respect to all First Nations, Inuit, and Métis peoples, their ancestors, their elders, and their valuable past and present contributions to this land. Ottawa Public Health is pleased to welcome you to the launch of the Mental Health of Ottawa's Black Community Research Study. The Mental Health of Ottawa's Black Community Research explores the experiences of Ottawa's African, Caribbean, and Black community in relation to mental health and the mental health care system in consultation with Ottawa's ACB community. This research was undertaken to assess the views and perceptions of mental health in the community, as well as behaviors and interactions with mental health services in Ottawa. To identify significant gaps and strategies to improve services and advocate for better services and support for the ACB community. A total of 130 people from Ottawa's ACB community participated in this research study. Now, during today's webinar, you'll hear from Mayor Rawlson and the Ottawa Board of Health Chair, Councillor Eglai. Following the opening remarks, the researchers will present the findings and recommendations from this research study, and I will then introduce you to our esteemed panel who will respond to how the recommendations impact various sectors in our city. So without further ado, I'd like to welcome the Mayor of Ottawa, Jim Rawlson, to share opening remarks. Mayor Rawlson.
Thank you very much, Adrian, and thank you, Adrian, for taking the time from your hectic schedule of being a news anchor and a father to participate as the moderator. Really appreciate your time with us this morning. Good morning, ladies and gentlemen. Bonjour, bon matin, mesdames et messieurs. Je tiens à remercier Santé d'Ottawa, Santé publique d'Ottawa de m'avoir invité à la présentation de cet important rapport sur l'étude de research sur la santé mentale de la communauté noire d'Ottawa. I want to thank Ottawa Public Health, Dr. Etches, Councillor Keith Eglai, the chair of the board, and all of the great staff at OPH for inviting me to the launch of this significant report on the mental health of Ottawa's Black community. I want to take the opportunity to specifically thank the researchers, participants, and our esteemed panelists, including our colleague and my colleague, Rawlson King, for joining us today as we seek to better understand and improve the experiences of Ottawa's Black community in relation to mental health and our overall healthcare system here in Ottawa and, for that matter, throughout Canada. There's no doubt that these last few months have been some of the most challenging in the city's history. This has been the case even more so for those from low-income or racialized communities. And as we've learned, it is these communities that have been impacted the most by the effects of COVID-19. Much like our collective efforts to flatten the curve and eliminate COVID-19, our community must come together to limit and end the spread of racism. The city has taken some preliminary steps to address systemic racism in our community right here at City Hall. In November 2019, a proposal by Councillor King to establish an anti-racism secretary of the City of Ottawa was accepted. I included funding for the Secretariat in the 2020 budget. The City of Ottawa committed funding for a full-time anti-racism specialist and the development of a corporate anti-racism strategy. The work of the Secretariat will add an anti-racism lens to the city's strategic plan and policies, and it will build on previous work done to address racial inequality, inequity, and systemic racism. We're pleased that Yusra Osman was selected as our new anti-racism specialist. Ms. Osmond is an experienced trainer on anti-racist frontline work, anti-Black racism, and Black community health, and we are thrilled to welcome her to the City of Ottawa team. We've met virtually, but not in person yet, and I look forward to that day very, very shortly. In addition to the Anti-Racism Secretariat, City Council approved my nomination of Councillor King as the Councillor Liaison for Anti-Racism and Ethno-Cultural Relations for the 2018 and 2022 term of Council. Well, I have no doubt the appointments of Councillor King and Ms. Osmond will go a long way in addressing racial inequality and systemic racism in the City of Ottawa. Ultimately, the task will collectively rest on all of our shoulders. It's fair to say that OPH already has done a lot on this subject, but they also have a lot of weight on their shoulders dealing with COVID-19. But despite this, Dr. Etches and her team continue to do extensive work on mental health and substance use and tackling the stigmas associated with them. One way that this has been done is working with the African, Caribbean, and Black community, or ACB, to develop and deliver the first ever African, Caribbean, and Black community mental health report in the history of the City of Ottawa. This research was undertaken to assess the views and perceptions of mental health in the ACB community, as well as their behaviors and interactions with mental health services right here in Ottawa. This was done to identify significant gaps, to develop strategies to improve services, and to advocate for better support for the ACB community. The report on mental health of Ottawa's ACB community is a result of a collaborative work project between OPH, Ottawa Public Health, and over 14 partners who advocate for and deliver mental health support services to ACB communities. I want to sincerely thank all of those organizations, those 14 organizations, for their dedication and commitment to creating a city where mental health is valued, promoted, and supported. Je tiens à remercier ces organismes pour leur dévouement et certainement pour leur détermination visant à créer une ville où l'on va voir protéger et favoriser la santé mentale ici à Ottawa. I want to thank community members for your work in making this research and report a reality, and for your contributions to these important recommendations. This reflects a strong commitment to people in our ACB communities, as well as those living with mental health challenges and with people who support individuals living with mental illness. On behalf of the City of Ottawa and Ottawa Public Health, I want to thank all of you for joining in this event today and for your work in promoting positive mental health and wellness in Ottawa. I'm sure this will be an enlightening and very productive session that will set a course for future action. I hope everyone has a safe, healthy, and enjoyable summer. Passez-vous des belles vacances d'été reposantes et sécuritaires. And again, thank you, Adrian, for your contribution, and thank you, ladies and gentlemen, mesdames et messieurs, for your participation this morning. We'll hand it back to our moderator. Merci.
Thank you so much, Mayor Watson. First of all, thanks so much for your kind remarks. Thanks for your presence and for your opening statement, your opening welcome. We do appreciate you being here. I'd now like to welcome the Ottawa Board of Health Chair, Councillor Keith Egli, to say a few words. Councillor Egli.
Good morning. Can everybody hear me?
I can hear you okay.
Good morning, Adrian. Good to see you again, even if virtually. Bonjour, Quay. I'd like to thank everyone who took time to join with us today for this event. While I'm always happy to showcase the good and important work of Ottawa Public Health, I'm also reminded of the importance of partnerships and local collaborations across sectors when it comes to public health. So thank you to the many partners for being here and collaborating with us on this important work. As some of you know, at its meeting of June the 15th, 2020, the Ottawa Board of Health adopted a motion recognizing racism as a public health issue and directing Ottawa's Medical Officer of Health, Dr. Vera Etches, to develop an evidence-based campaign to increase awareness of the impacts of racism and discrimination related to COVID and actions to counter racism in Ottawa. Through that same motion, the board also directed Dr. Etches to seek further community partnerships to implement recommendations to improve African, Caribbean, and Black mental health in Ottawa. Among other things, the motion acknowledged that racism, discrimination, and stigma are associated with poorer physical, mental, and emotional health, and recognized public health's role in promoting the health and well-being of the entire population. As such, I'm very pleased this morning to and look forward to learning more about the initiatives that will come from this particular report. I am told that some of the initial actions taken by Ottawa Public Health include things such as prioritizing the organization's wide systemic collection, use, and disclosure of socio-demographic data for all service areas as appropriate. This will contribute to knowledge of socio-demographic profiles and health status of individuals accessing OPH services, identify and monitor differences in access, care and health outcomes for priority populations relative to other service users, and allow OPH to modify services to address unique individuals as well as populations' needs by offering tailored and culturally sensitive programs and services. Developing content and facilitating virtual health promotion sessions to reach Ottawa's racialized and ethnocultural populations with mental health and COVID-19 messages. This enabled OPH to reach 225 residents with information on mental health and food security. Hosting consultations with ACB leaders to review findings and recommendations of the mental health of Ottawa's Black community research study. 11 leaders from 9 organizations attended, including staff from Councillor King's office, African Canadian Association of Ottawa, Max Ottawa, and Justice for Abdiram J4A Coalition participated. Creating an anti-racism steering committee and conducting an organization-wide self-assessment review of current and past anti-racism work. These are but a few of the initiatives underway at OPH aimed at recognizing racism as a public health issue, combating racism, raising awareness, reducing stigma, and improving the mental health of Ottawa's African, Caribbean, and Black community and other racialized communities. As chair of the Board of Health, I am very proud of this work and look forward to much more to come. Again, thanks for joining us this morning, and thank you for your support, your cooperation and partnership as we face these issues together. Back to you, Adrian.
Okay, thank you very much, Councillor. Did you hear me there? I think I'll say it again. So please join me in welcoming the researchers of Ottawa Public Health's Mental Health of Ottawa's Black Community Research Study, Dr. Chinedu Oraka and Hoden Aiden, who will share findings and recommendations for this research study. Chinedu and Hoden.
Thank you, Adrian, for the introduction, and thank you to Mayor Watson and Councillor Eagleye for your opening remarks and for providing context. We appreciate you being here. And in case I don't get a chance to say this at the end of the session, a heartfelt thank you to our valuable panelists. Shinedu and I are truly grateful for your enthusiasm and your willingness to be part of this launch and the launch of this report. It further validates to us how important this topic is to our community. So Adrian and Mayor Watson mentioned the objectives of this research study, and The key objectives are on the screen, but in short, the primary goal was to contribute to race-based data collection for this population in relation to mental health, at least from a local perspective. And this was data that did not exist before. The lack of race-based data is not unique to mental health or the healthcare system, but is a concern for racialized populations, both locally and nationally across various sectors. As a advocate of Black and racialized mental health, Kwame McKenzie was quoted in saying, if you don't count people, then they don't count. And so their needs aren't met and they're less likely to receive quality services. And so the issue and the fact that most institutions do not collect race-based data can be considered or is an example of anti-Black racism. Our hope is that the collection and analysis of this data can contribute to actionable recommendations that will improve the mental health services for this population and improve services for this group. So the research question we set out to answer was, what are the experiences of Ottawa's Black community in relation to mental health and the mental health care system? And to answer this question, we developed a mixed method study, which integrates both qualitative and quantitative data. And so we had 130 participants complete the surveys. 100 completed the quantitative portion, which consisted of questions that were selected by the community and questions that were similar to what's asked on the Canadian Community Health Survey, so that we can draw some comparisons between what we're seeing in the research participants and what we know to be true for Ottawa and local average for local residents. And so both surveys were administered separately, analyzed separately, and then we brought them together to compare and relate. This is just a snapshot of our inclusion criteria. I won't go into it in too much detail, but just to say that we received REB approval to be able to administer the surveys to those that are between the ages of 16 to 64, who live in Ottawa and who have who identify as Black, either have both parents who are of African or Caribbean descent, or having one parent who is of African or Caribbean descent. So before getting into the findings, Sheila and I wanted to take a moment to sincerely thank our partners who guided this research from inception. They helped develop the questions that we asked in our surveys. They helped us with recruitment. They informed the recommendations. Oftentimes many of our partners provided us with space to conduct the interviews. And so we would not have been able to reach our target of 130 as quickly as we did without their support. So we are very appreciative and are thankful for your continued involvement in this project. So this is a highlight of the demographic data. It doesn't contain all of the demographic data, but it shows that although we administered the survey to those between the ages of 16 to 64, 87% of our participants were younger than or under 40, which is not surprising. Canada's and Ottawa's ACB population is younger than the general population, so that's not surprising. We had 64% were born outside of Canada or were immigrants. We had a mix of, we had a good ratio, 1-to-1 ratio in terms of female and male respondents. 75% spoke English, while almost a quarter were bilingual. Close to half, 43%, had an annual household income of less than 60,000. All study participants were recruited at events and institutions across the city where we know are attended by people of ACB. So we are, the research participants shared personal aspects of their lives with us during these interviews. And so we're honored to have had the opportunity to listen to their stories. And I hope that through us going through the findings that we can bring some of those stories to life. So the study explored facets within each of the following 4 broad themes. We asked people about their beliefs and perceptions of mental health. What does mental health mean to you? You know, if you hear someone has a mental illness, what comes to mind? How would you rate your mental health? If you had, if you wanted to talk to someone about your mental health, would you feel comfortable talking to someone, and who would you talk to? We asked about protective and risk factors. What are some factors that impact your mental health in a positive way, and what puts you at risk? Tell us about a time you access services for yourself, or you access services for a loved one. What worked, what didn't work? And tell us about the interaction with the mental health care provider once you were able to get access. How did that interaction go? What was your experience like? And what would you recommend in improving your interaction with healthcare providers and in accessing services? And so each of these four main sections integrate findings from both the quantitative and qualitative findings, because the insights drawn from the one-on-one interviews provided helpful context to the survey results. So as I go through this, also just keep in mind that we administered these surveys prior to COVID. And so people's mental health and their stress levels now are very different than when we administered these surveys. And just knowing that from our own SDOH data, COVID-19 disproportionately affects racialized communities, including ACB communities. So I'll start going through the first category on beliefs and perceptions about mental health. In general, ACB populations or ACB participants self-rated their mental health, sense of belonging, and stress level better than the general population or Ottawa's population when we look at the average for Ottawa. 59% of our respondents said that they were very knowledgeable about mental health. And when we asked in the qualitative, how would you describe mental health? They associated good mental health with psychological balance, coping, and ability to manage stress. Almost half, 48%, said they experienced some prejudice and unfair treatment in the past 12 months. And this wasn't related to anything specific. This was just in their day-to-day life. Almost half had said that they experienced prejudice or unfair treatment. 74% feel worried or sad for someone who has a mental illness. And in the qualitative portion, many of the respondents used words like, someone who has mental illness is an individual who's suffering, or someone who's crazy, to describe an individual with mental illness. And a lot of the participants talked about the stigma in the community. It's still prevalent. 27% of the respondents were not comfortable talking to someone about their mental health for fear of being judged or not wanting to appear weak. So I'll just read a quick quote for you here of one of our participants. When you tell people that you have a mental illness, there's a stigma associated with that. And that would stop me from sharing. I would rather keep it to myself. Many responded this way, although there were a handful of participants who said, the fact that we hear there's so much stigma in our community is detrimental to healing, because it prevents us from actually sharing this with loved ones and with friends. And when they were able to share, they were surprised to find that their families were very understanding. So I just wanted to share that piece as well. So while some of these findings in this category are promising and we have some positive findings, the protective and risk factors shared by ACB participants tell a different story in terms of their ability to manage mental health. The top 3 protective factors in order cited by the participants are employment, which was considered to be the most important protective factor because it was directly associated with enhanced access to resources and greater protection from risk. The second most cited protective factor was self-care, which manifested itself in different ways. So people talked about sleep, physical activity, eating well, going out in nature. But one thing that stood out was spirituality. It was one of the most important strategies to maintaining good mental health for the participants. Places of worship, such as mosques or churches, provided them with spiritual counselors with similar beliefs, similar values, and often people that looked like them, that they could, that they feel comfortable sharing their mental health concerns and getting support from. The third factor is social connectedness, and this was cited as a key factor in managing and caring for mental health. So having supportive family and friends who are non-judgmental was considered an important protective factor. On the other side, in terms of risk factors, as we noted in the protective factor, gainful employment and financial stability ranked highly as a protective factor, and it was critical in terms of maintaining positive mental health. And so unemployment and financial insecurity were viewed as a major risk, especially when it's linked to not having access to funds to seek private care, not having permanent employment where you would have access to insurance. The second risk factor, an overwhelming number of participants identified discrimination and daily experiences of microaggression as a major risk factor for mental health and was associated with lack of advancement in society. The third risk factor associated with poor mental health was social stress, specifically trauma, witnessing violence within neighborhoods, witnessing other forms of injustices, including police brutality, having to relive these injustices through social media, whether they happened in the past or it's something that happened recently. Participants spoke to being re-traumatized every time they see someone who's Black being violated or mistreated in some way. And lastly, some of the other risk factors people talked about was not having a supportive family and not being able to discuss mental health in your community, not having a healthcare provider that they trust and that they can identify with. I'll just read a quick quote from this section. It's not that mental health is not being prioritized, but it's that we still face such high rates of employment discrimination. We're worrying about how we are going to put food on the table a lot of the time, and how or where or when our contract is going to end. That when you're thinking about mental health, that's a luxury for some people to think about, to be very honest, end of quote. So these are a list of some of the factors which either facilitate access or are barriers to accessing quality mental health services. The most frequently mentioned locations for seeking mental health services were hospitals or community health centers. Those two locations were almost neck and neck in terms of participants' responses. The third highest location where people sought mental health support was faith-based centers. Some of the factors that facilitate access that ranked high were a provider that understands my needs, affordable services, a provider with similar cultural and racial identity, and having adequate employment. So in this section, there was a clear need for a more diverse and inclusive mental health workforce, one that better reflects and represents members of the ACB community. Some of the perceived barriers included cost of service, long wait times, lack of shared identity, unemployment, language barriers, facing discrimination, not knowing where to get help. And then when you do get help, sitting in front of a provider that is not aware of their cultural background and their needs. So lack of cultural competency came up quite a bit in this section. Just looking at the interaction with mental health care providers, 72% expressed some satisfaction with their provider. 58% cited lack of shared identity as a barrier, and nearly 1 in 3 who accessed care felt prejudice or negative attitude towards them. And when we asked, what made you feel that way, they said dismissive behavior, comments that were made to me, feeling prejudged or feeling that like assumptions were made about me before I even got there. Poor provider attitude, lack of cultural competency, racism and discrimination, and systemic issues were among some of the other reasons for saying that they had poor experiences with interacting with mental health care providers. I'll just read another quote here. I wanted a Black councillor, and for me that was really detrimental and demonstrative of marginalization and of inaccessibility to mental health services. It shows that we still work within this dynamic of white supremacy, in which the things that are understood are the things that affect the majority, and the majority in this country are white. Another person said, in Ottawa and Canada, one of the things that's really hard for me is racism and oppression. It's so difficult to see people consistently striving and working and just feeling like we can't get ahead because of the system. It's really overwhelming, and that creates a lot of hopelessness. So these are just sort of the highlight of some of the findings in the 4 categories, both integrating the qualitative and quantitative pieces. We do have a few more testimonials that I wanted to share with you from our participants. This one story, one of the participants said, I went to a walk-in clinic because I didn't know where else to access mental health services. I was really struggling. The doctor at that point, without even exploring anything more, tried to get me admitted. It was like a complete escalation. There was no exploration of what was the need or anything like that. I had no intentions of harming myself or harming others. I remember feeling really scared, and I felt really overwhelmed by the whole process. I just needed to have a phone number, and it escalated to me being admitted. And this was something that was common, the experience of over escalation, or either people are either there's over escalation, or they receive less care. Someone said, one of the other participants said, I think that's why most of us are dealing with some type of symptom of mental illness, just because of being in survival mode and constantly having to fight every day just to get basic necessities met has a really dramatic impact on mental wellness of immigrants. This will be the last story I share. So one of the participants said, I mentioned to the doctor that I was seeing, I was dealing with a mental health issue and how I wanted to talk to someone. He responded by saying, you're not depressed. You don't look depressed. I didn't know there was a look to being depressed. And he said, no, don't worry about it. I know what depression looks like, and you're not depressed. It just made me feel bad about myself because it invalidated my experience, and it made me feel like I'm not deserving of care. That day, I walked through traffic going to the doctor's office. I was disoriented, and I walked back through traffic. I had no idea what was going on. Cars were honking, and I was crying. So I hope through the findings I've been able to demonstrate the multiple intersecting factors that affect people's mental health. The recommendations of this report or this research are based on both best practices from literature and strategies that were identified by our participants, as well as community recommendations from community and ACB leaders who we met with once we had preliminary findings. And so Shinadu will talk about these 4 pillars and how we've organized the recommendations from this research study. These 4 pillars are the Mental Health Commission of Canada's Advancing Mental Health for Canada. So multiple factors affect people's mental health, and so the approach to improving services for these populations have to be multifaceted. So I'll invite Shinadu to go over these four categories.
Thank you, Helen, for teaming me up perfectly for this. Also, thank you, Adrian, for the introduction. So go straight into it. We know that to improve the mental health of Black communities requires ensuring equitable representation and hiring of ACB staff within various workplaces. And we do this by recruiting counselors, teachers, law enforcement officers, and healthcare providers who are of African descent and who understand the unique mental health needs of ACB students, clients, and the ACB community. More importantly, representation at the leadership level where decisions are made about the allocation of resources and the development and implementation of new services. So these are some of the recommendations based on leadership and funding, like you've heard from Hodan, one of the 4 pillars from the MHCC framework. Also, we know that it is at leadership tables that investment and funding decisions are made. Investment and funding are needed to create culturally relevant services for ACB populations, and this could mean expanding existing mental health services to reach ACB populations. The report is also clear about the experience of racism and discrimination. So we recommend anti-racism competency training for those in leadership positions, and we strongly advocate that funding be set aside for mandatory anti-racism training and competency training for frontline staff. These trainings are crucial in helping service providers examine and question their beliefs and biases as it relates to anti-Black racism, microaggression, and oppressive practices, as well as providing people with skills and knowledge and how to safely interact with the ACB population, uh, interact with the ACB community, and avoid dangers of unnecessary escalation. Lastly, strategies that are focused on improving the mental health of ACB communities are heavily dependent on eliminating structural barriers and addressing the root causes of social issues. This means improving social policies targeted at addressing decent, affordable housing, anti-poverty measures, income support, employment opportunities, and safe neighborhoods that will positively contribute to their well-being. Next. Recommendations based on promotion and prevention. Uh, we, uh, uh, we recommend developing mental health promotion strategies that will focus on promoting positive mental health, resilience building, decreasing risk-taking behaviors, and increasing awareness of supports and services currently available to immigrants and their families in schools, faith-based, and community centers. We recommend increased collaboration between the various sectors, that is the school boards, the neighborhood police resource teams, and workplaces, and collaborating with the community and the public health unit to develop programs that will promote ethnic identity and community cohesion. Capacity building and knowledge exchange is also a strong pillar where we recommend working with faith-based leaders to provide mental health literacy, resilience building, and suicide prevention training. Holden mentioned earlier when she was presenting the findings that participants mentioned that faith-based centers were the third most common places they go to seek mental health need. So it's important that we build the capacity of the faith-based leaders in providing mental health literacy. Also, to increase the capacity of the ACB community to participate in knowledge transfer and exchange activities with health organizations that are aimed at improving the mental health experiences of the community. A last point on this pillar is the implementation of anti-racism policies and guidelines to support anti-racism programs to enhance social inclusion. For example, cultural sensitivity and anti-racism training for administrators, teachers, and counselors. Also to review school curriculum as it exists for equity gaps and to commit to following the existing curriculum, that is teaching that there was slavery in Canada while applying an equity lens. Also to introduce Afro-Caribbean history in the school curriculum. The third recommendation was based on access and services. So recommendations in this area aimed at improving access to quality and evidence-based mental health services, treatments, and supports that exist within the community. The need to improve access to culturally responsive services requires investment in mental health services that will meet the needs of ACB clients. So this will require healthcare settings, schools, justice sectors to assess the ability to meet the needs of ACB clients and begin implementing strategies to improve services for this population. A second important factor cited was being able to access a provider with a similar cultural and racial identity. Participants reported that it was extremely important to have access to a provider who understands the experiences of being Black in Canada. So we recommend that healthcare settings allocate funding to increase availability of counselors who are of African descent. We recommend the school boards designate a mental health lead or psychologist who can respond to the needs of ACB students. We recommend to increase mental health treatment and supports for ACB people in preventing them from entering the criminal justice system and to ensure law enforcement responding to mental health crisis in the community have adequate access to mental health nurses or social workers from the police mental health units. All sectors identified need to develop anti-racism policies that embed social justice, anti-racism, anti-oppression, and anti-discriminatory practices. On monitoring and evaluation, we recommend that healthcare settings, school boards, justice sectors support M&E systems that will designate to collect data on access to services received by ACB clients and that these M&E indices are reviewed quarterly for quality assurance. The fourth recommendation, data and research. Although study participants did not speak directly to the need for more data and research, and you've heard from Holdan in the introduction, that we recognize that there is need to monitor the population level information on mental health and illness. And also the MHCC recommends improving data collection for this purpose. So on data collection, we recommend surveillance data collection to monitor population level information on mental health and illness by promoting race-based data collection at all levels, periodic monitoring and evaluation of racial, ethnicity-related variables, and how these impact on health outcomes and health surveys and databases to inform future planning. We recommend for increased funding for research and monitoring activities on mental health in the ACB community to better understand the complex ways in which Black community experiences racism and its impacts on mental health. And lastly, we emphasize and we strongly recommend for cross-sectoral data collection, data sharing, and interdisciplinary collaborating research to better understand how mental health of Ottawa's Black community is affected by the social determinants of health. For next steps, as researchers, we recommend that various sectors reconvene in 12 months from the release of this report to assess the progress on the outline recommendations, to identify challenges and brainstorm on solutions, and share success stories and best practices for knowledge exchange. This was a strong point stemming from consultation with the community, where the community expressed their concerns and making sure that this report doesn't go like some before it, or similar ones before it, and just taking up real estate and archives and shelves, but that we, the various sectors, leaders from the various sectors in the community commit to reconvening and sharing ideas and success stories and challenges on implementing some of these recommendations. So this brings us to the end of our presentation. We hope the findings will contribute to the data for Ottawa's Black community. We also hope that recommendations will lead to improved collaboration in the management and delivery of mental health programs and services. Thank you for listening. Back to you, Adrian.
Okay, well, thank you very much, Shinedu and Hoden, for your very detailed and thorough presentation this morning. Thanks so much for that. I would now like to introduce you to our panelists who have joined us today to help answer some questions, and I'm going to introduce them in alphabetical order. Camille Williams-Taylor is the Director of Education for the Ottawa-Carleton District School Board. Chief Peter Sloly is Ottawa's Chief of Police. Councillor Rawlson King is the Ward Councillor for Rideau-Rockcliffe here in the City of Ottawa. Dr. Vera Etches is Ottawa's Medical Officer of Health. And Sheila James is a Diversity and Inclusion Specialist at the City of Ottawa's Human Resources Department. So welcome, and thank you all for being here today. Can everyone hear me? Can you hear me okay?
Yes, we can.
Okay, super. So based on the research findings and recommendations, the research team developed 2 rounds of questions for the panelists. And so I'm going to start with Dr. Etches. Dr. Etches, first of all, thank you for being here. Thank you for taking the time out of your very busy schedule, and congratulations to you and your team for conducting this research study. The question I have is why, can you just tell us why this research was important for Ottawa Public Health?
Thank you. It's a good question. I'm not a fan of studies where it's a study that is just going to delay action when we have enough information to take action. But in this case, we heard from the community that there was a lack of data about the mental health needs in the community and about the experiences that needed to be addressed to promote mental health. So it really is about having the information we need to guide local action. And, We know in general that we see communities with less advantage do visit the emergency department, for example, twice as often compared to communities with more advantage for mental health reasons. We could imagine racism and discrimination affect mental health, but bringing it down to specific numbers, the quantitative data really holds us accountable to show us what we need to improve here. And it gives us a bar and a measure to take that action. I also think it's been very important and invaluable that you can see the qualitative information helps us understand what do we need to address and tackle to improve those numbers. So appreciate the studies had both types of information. And I also want to say that the process itself has been very important because it's engaged service providers, Ottawa Public Health more closely with members of the community. Again, building understanding and building commitment to action and a coalition ready to act. So I appreciate that. Unfortunately, since this study happened, we have seen that members of the African Caribbean Black community on a population level do have greater stresses right now because of COVID-19 and higher risks of infection. And so it's more important than ever to use this information to make sure we can provide the right supports and address the complex factors that go into this result. So I'm again very thankful to have this information now to inform action.
And Dr. Etches, just very briefly to follow up. So what do you think, what are the lessons that you and your team have learned going through this process? What are some of the things that perhaps are clearer now that weren't as clear before?
Well, I think it's hard to ignore when you see very clearly that in our community, 48% of the participants reported addressing, being treated unfairly or facing prejudice in the previous months. That has to change. So it's it's something that gives us a benchmark. What we see here, I think that's most valuable and really I find is useful is understanding the specific risk factors that were identified. So employment, absolutely being one, the financial instability. We need to take that seriously and look at how do we employ members of the community more equitably and address some of the things that we can see will make a difference, as well as the protective factors. So we know that mental health promotion is one of the things we do in public health. We try to keep people well, and here we have some great information that we need to be working with communities, building on those strengths. So the community sense of community belonging is fabulous to see, and we need to work with communities to understand and reinforce how that contributes, as well as some of these things that are maybe more specific to the African Caribbean community we've seen around how to support mental health through faith-based settings as well, where people can support and provide access to evidence-based resources. So there's some specific ways we can follow up that come out of this work. Again, really appreciate the commitment of community partners to help us and keep informing, and helping us evaluate if we're making progress.
Okay, thank you, Dr. Etches. Chief Sloly, welcome. Thank you for being with us today and for the work that you've begun to do within the Ottawa Police Service around mental health and anti-racism. Can you share with us some of the work that OPS is doing to build capacity and training within its ranks and frontline officers in de-escalation measures while interacting with the ACB and racialized communities? I don't think we can hear you, Chief Sloly. Okay, I think we can hear you now.
That's great.
Okay.
Right. Been struggling with some technology challenges this morning, but I think we got it sorted out.
You're not the only one. You're in good company.
I'll just echo previous comments from others. I really appreciate the effort to research this, report on it, and share it more broadly. And then those who've worked to put this on as a conference and a panel, and Adrian, your hosting of it. gracious in that area. I know the questions around de-escalation. Let me hit that right up. I don't want to dance around things. De-escalation training is one of these terms and aspirations thrown around a lot, and particularly in the last 5 years. Let me be clear, there's no actual standard on that. The training is very varied across policing, never mind other institutions and organizations that provide security. I've actually asked my people, do we have a working definition and standard of de-escalation training in the Ottawa Police Service, in the province of Ontario under the Police Service Act and its regulations and standards, or anywhere in federal statute? Is there a best practice in policing in Canada, in North America, in the Five Eyes countries, or anywhere in the world? And so far the answer is no. There's lots of very well-intended and well-funded efforts, but we don't actually have a working evidence-based model. So one of the first things that I'm going to be doing here, and I've already put this underway with my own training department, is let's get a working standard based on evidence. If we don't have one, let's develop one, and let's develop it in partnership with the community and with mental health providers, social workers, and people who have expertise and experience in this area that can inform and guide the design, the implementation, and ultimately the evaluation and continuous improvement of whatever we do in terms of de-escalation training going forward. No doubt, whatever we do at point 0 will have to be continually reviewed and improved at point 1, 2, 3, and onwards, because whatever that we do in this area will have to be continually reviewed, not just by the police, by external bodies as well, and improve on an ongoing basis. So that's my direct answer to you, Adrian. My secondary answer, and I know you've got other important questions to ask other panelists. I'm not a big believer in training being the solution to the types of issues that have been uncovered in this particular report. This is systemic racism. This is institutional change. This is culture. This is historic practice. And a bucket of training thrown at a frontline police officer or at a chief of police is not going to get to the level that I think is actually being spoken to in this report, in the expectations and frustrations of those who contributed to the report. So I see training as part of the solution. I see it not as a significant part of the solution, but as part of the solution. I will try to do it as best as I can and continually improve what we do using external advice, evaluation, and best practice. But ultimately, I think there are bigger issues that need to be tackled. And if time permits, I'll be happy to share some of those thoughts. I've shared them in other public forums with CBC. I've shared them with the Standing Committee on National Security and Public Safety. But I'd be happy to share those comments if time permits on this program as well.
Your statement might surprise some people who have not heard you say that before, and it might confound people a little bit, because a tremendous amount of money is invested in training, and people have been led to believe that training is the panacea, or that training can lead to significant change. Why are you so skeptical about the value and the significance of training? Why isn't it the answer, or why doesn't it kind of move us closer to where we want to be?
Yeah, that's a great question. I understand it. Let me just correct one thing, and you can choose to agree to disagree, and so can the audience. I wouldn't say a tremendous amount of money has been invested in it. A lot of attention has been invested in it.
I'm saying in society, in different institutions.
Yeah, absolutely. So, I suspect nurses and doctors and teachers all have a similar frustration. Something's gone wrong in the system. Someone's been hurt, someone's been disappointed, someone has been abused. Let's train the person or the person's doing it. I get it. It's a quick fix, easy. I can see it, I can call it, I can fund it, I can point to it on the org chart. That has not been my experience in working in 3 different careers, in 2 different police services, associated to 53 different police services around the world, and academics who have studied this over and over again, experts in various fields. Training is a necessary ingredient, but not a sufficient ingredient. When it comes to attitudes, which is what the systemic racism research is around public health and how it is an intersectional approach with other institutions like police and education and housing, we're talking about attitudes and character, and we're talking about cultural and institutional policy. Training cannot adjust those things. Think about your own children and your own families, your own experience, Adrian, growing up. You learned how to learn. You learned how to be a good student. You learned how to develop good study habits. Can you remember any more than 3% of what you were taught? No. You apply your character and your development and your work ethic, your personal values and your organizational values to help you problem solve and manage your way through decades in your career. But retention Intellectual retention of content provided to you in training has minimal impact on your thinking, your decision-making, and your actions, and certainly minimal impact in terms of actual crisis or high tension related activities. And so it's not insignificant, but it is not sufficient. And that is what I'm saying. I'm not cynical about training. I'm just facing the hard truths. Development of character, continuous development of the supports around individuals that maintain that character, institutional policy and systems and processes that maintain the best quality human beings so they can provide the best services, oversight, external evaluation and integration of services, I believe are actually a far more superior set of tools that will move us further to the types of outcomes that are expressed by the researchers and expressed in terms of the expectations and frustrations by the community members.
Given what you said, I would be remiss if I just didn't ask one other question before I go to Camille Williams-Taylor. Well, then what is the value of training?
I said it has value. I just don't think it's the panacea of everything.
What is the value? What does it do?
Well, okay, so and again, I'm not an education expert, so that your next speaker will probably debunk some of the mythology that I'm even piling on here. But here's my not uninformed, but non-certified opinion on it. I think it's very good for technical skills. So if I need to have a recipe list of items to be able to write a report, to develop a problem-solving logic model, then training around those technical pieces, whether they be a memorization, rote memory type of activity, or here's a sequence of steps you do to get from point A to point B. That's training, in my humble opinion. Development is taking the application of the knowledge and the tool and saying, here's how you effectively, ethically, consistently, legally apply it across a broad range of stressors. Whether you're having a good day or a bad day, you need to maintain the highest level of professionalism and compassion and understand your true mission in order to apply the knowledge we've given you and the tools. Listen, I've got young kids. I teach them all sorts of things, but they're too young to apply some of those tools. They can't consistently do it. So even if they're trying their best little efforts at 6 years old and 14 years old, they still will make mistakes with the technical knowledge I've given them. It's the passage of time and the acquisition of wisdom and consistent character that allows any individual, never mind a police professional, to be able to do it at a level that meets community expectations.
Okay, thank you so much, Chief Sloly. We do appreciate that. Camille Williams-Taylor, I'd like to ask you a couple of questions regarding the work of the Ottawa-Carleton District School Board. We've heard that many regions and school boards, including the Francophone school boards in Ottawa, are taking the issue of supporting the mental health of Black students very seriously. We've heard that the Ottawa Catholic School Board will be training all staff this year on anti-racism and mental health, and will be holding a Black student forum to hear student voices on the important topic of mental health and well-being. Obviously, this is a positive development. In addition, recently in June, the OCDSB shared findings from the Valuing Voices Identity Matters Student Survey, which provided identity-based data. As we all know, many factors impact mental health, including...
My apologies, Mr. Harewood. I hate to interrupt, but Camille will not be joining us until 10 o'clock. Are we able to perhaps move on to somebody, one of the other panelists?
Sure, absolutely. So I'm gonna turn to Sheila James right now, and I'm gonna ask you just a couple of questions regarding the work of the City of Ottawa's diversity and inclusion team. Inclusive hiring and representation are important recommendations from this report in terms of improving experiences for the ACB population. Representation and shared identity with the provider are critical when receiving mental health services. In addition, as we've heard, employment and financial security are the #1 protective factors in terms of good mental health and access to services. Can you speak to how the city's diversity and inclusion strategy can improve hiring practices for diverse populations? What efforts are being made to ensure that equitable hiring and representation of ACB people in the workforce?
Thank you very much, Adrian, and it's a pleasure to be here. And the City of Ottawa, as you know, is very committed to creating a diverse workforce and an inclusive workplace. And to this end, we have developed quite an extensive, comprehensive corporate diversity and inclusion plan with about 55 different actions and tactics, which affects the whole organization. We can always do more and deepen our impact, but the most important, I guess, of these actions is the equitable hiring of racialized and other diverse groups. And not just hiring at entry-level positions, but in secure permanent positions, because we do know that racialized people, for instance, are overrepresented in precarious jobs. So that detail is also really important. So we have adopted strategic approaches to each step of the hiring process, starting with outreach and recruitment. So we have a robust outreach and recruitment plan. We invite community members to city events, such as our annual career showcase. And this is where residents can learn like how to apply for jobs. They can build their resumes. They can network with city staff and learn more about what's required, what the city's looking for, and how they can apply their best skills. We also have city staff moving into the community. So for instance, hiring managers will go to diverse community forums, they'll speak on panels, they can talk about various positions at job fairs and connect directly to our potential workforce. And we also have a HR service center that responds to questions. So that community connection on the grassroots is really, really important. We also have regular input from a network called the Community Champions Network Table. And this is made up of representatives of organizations serving diverse populations. And they publicize jobs to their networks, but they're also learning about the city's processes directly. And they also have a space to network and have knowledge exchange with each other. And I just wanted to mention that there are representation from groups that serve the ACB community, such as the Somali Center for Social Services, Ottawa Local Immigration Partnership, Canadian Friends of Somalia, etc. And that direct hearing directly from these partners who are representative of these disadvantaged communities and minoritized communities in the city is so important. Once somebody applies, individuals are invited to fill out a self-identification form. And this is really important. There's a lot of stigma sometimes we find with our communities around filling out the forms, because some people know from firsthand information from being in different countries that race data has been used against them. We try to make our communication positive so that we have proactive anti-discrimination policies, and filling out these forms is important because, of course, we can track who is actually applying, and then we can look at mitigation strategies or focused outreach strategies to reach the groups that are underrepresented in that applicant pool. When we go to the interview stage, I think the City of Ottawa is actually doing some very progressive and innovative things to make the process of interviews very inclusive. So we use inclusive hiring practices. And this is where we make the interview environment conducive so that candidates can do their best. For example, we offer the interview questions to all candidates 15 minutes before the interview begins. And this is very helpful for people with learning disabilities, with anxiety disorders, people who have learned English as their second, third, fourth, even fifth language. And what it does is it takes the pressure off of having to perform on the spot, and it allows them to provide thoughtful and reflective responses. We also understand that communication styles can be very different between cultures. So we encourage managers to ask prompting questions, to draw out people and to elaborate on providing fulsome responses. We also invest in cultural competency. So this is creating a deeper understanding of different cultural behaviors. Hiring managers can have certain expectations of how a candidate should behave in an interview. And I'll give you an example. The handshake, for instance, is very much a Western behavior. It's kind of a calling card to say, I'm professional, I'm assertive, I'm serious. But a lot of cultures, you know, we nod, we bow, we do namaste. And what is the effect of those different behaviors on a hiring manager? And this comes back to, you know, we'll talk about unconscious and conscious bias later, but it comes back to what are our expectations and how does this prejudice you against someone and prefer other candidates? What is most exciting for me, though, is that the city is developing strategic hiring practices. And this is very critical in closing the gap of representation. This is a process where we consider, of course, the qualifications of a candidate, as well as the corporate priorities of the organization. So one of those corporate priorities I mentioned, of course, is building and nurturing a diverse workforce. So to get there, we can use something called a priority hiring mechanism. So for example, if two candidates are fully qualified, but one candidate has the lived experience of being racialized, this perspective, this lived experience is valued and viewed as an asset for the organization. So the priority hiring mechanism means that of the two comparable candidates, the one that brings qualifications as well as lived experience will be offered the job. Now, the strategic hiring processes cannot be applied to all of our jobs because we are in a highly unionized environment. And so there are certain conversations that have to be had, you know, certain other priorities that come with that. However, we are looking at this. These are in line with Canadian Human Rights Act, the Ontario Human Rights Code special programs that support initiatives that ameliorate conditions of people facing barriers, and in this case, employment barriers. And finally, you know, once we do hire diverse staff, the final stage of this process is retention. So we want to create an inclusive workplace so that people stay at the city and can move and be promoted and take on roles of leadership. We need to create this environment where they feel they can raise issues if they're experiencing discrimination, and they will be heard, and these issues will be and are addressed seriously. We also support projects and initiatives like affinity groups. So these are employee networks of diverse staff so that they can connect and support each other. We know that minoritized groups their experience of the workforce is different from the dominant group. So we need to create specific supports, strategic supports, which is also a recommendation in the research paper, which was really important. So, you know, we know that this is really important to retain the staff, and that diverse perspectives and staff help to move the organization forward and expand the city's overall organizational culture. So I'll stop there, and hopefully that will give you an idea of what the city is doing to move this forward.
Sheila, James, you very clearly outlined the city's commitment to hiring a much more diverse workforce. Can you just share with us, though, some of these specific targets, hiring targets that have been established to ensure that you have that more diverse staff? And,
well,
also the timeline. So what are the targets? What's the timeline?
Well, we're looking at this plan, like enacting the corporate diversity and inclusion plan over a 5-year period. And what we do is we measure our representation against the national workforce availability rates. So our targets basically, and this is I think every organization that has access to the national availability workforce rates through the country, is to move closer to those targets. Right now at the city, and all of us are feeling this in our institutions, you know, with the COVID-19 pandemic, the notion of hiring within this situation is very difficult. You know, the mayor has talked about the deficit that the city has at the moment. We are getting funds from the federal government. And all of those things are going to impact hiring on a wide scale. but there are always opportunities. And so moving the dial wherever we can, whether that's in OPH, whether it's in our frontline services, but also the promotions of racialized and other diverse staff within when openings become available is also important. So there's movement, yeah.
But if you're not telling us the numbers and what you're planning to do, it seems as if there's a lack of accountability here. Is there not?
Yeah, well, no, I mean, we know that there's roughly a 20% national, a 20% representation of visible minorities that are trained, able to work within the region. And that's where we want to go, right? So that 20% marker of visible minorities, that's where we want to, that's what we want to achieve. And
but
this happens.
What's the consequence if you don't meet that target? I guess I think that's the question
Yeah.
that a lot of marginalized communities want to know. Like, if this doesn't happen, then what's the consequence?
Well, I think that, with every target, I think targets are different from quotas. Quotas are where there's a hard target and there is a consequence if you don't meet it, in the sense of, hiring managers can be taken to task and so on. Targets are a little bit softer because they take into consideration the context. Now, there's two things that will help us reach our target. Hiring more people in the workforce, which is important. And the other thing is having more people within the workforce self-identify. So there's two things that contribute to that. So one of the things that we are doing to ensure that more people will self-identify is we are rolling out a campaign called Count Me In. And this will, we're encouraging people to self-identify. We know that there are a lot of people, because we see them, who have told me personally, I don't identify because I don't see I don't see why we should. So our campaign, our communication campaign around self-identification is to actually, especially, and I don't want to put younger people on the spot, but a lot of the younger generation does not know about the history of the Employment Equity Act, how our grandparents and ancestors and peers have fought hard to make data visible so that we can close the gap. So our campaign is, I mean, we talked a little bit about education, but education in the sense of making people aware of the values, education in the sense of what does this mean for me? What does this mean for my children? So when we make data visible, we're able to say, you know what, we have done, for instance, we have done all this outreach to this community, but they're not coming, they're not applying. So what is the issue there? Or it could be people are applying, but they're not getting to the interview stage. What is the issue there? So by tracking all of these stages, we'll be able to be more focused.
Okay, thank you. Thank you, Sheila James. Camille Williams-Taylor from the Ottawa-Carleton District School Board. Thanks so much for joining us. I think you're there now.
Yes, good morning.
Good morning. Good morning. Camille, we've heard that many regions and school boards, including the Francophone school boards in Ottawa, are taking the issue of supporting the mental health of Black students seriously. We've heard that the Ottawa Catholic School Board will be training all staff this year on anti-racism and mental health, and will also be holding a Black student forum to hear student voices on the important topic of mental health and well-being. In addition, recently in June, the OCDSB shared findings from the Valuing Voices Identity Matters student survey, which provided identity-based data. Now, as we know, many factors impact mental health, including negative experiences within the school system. One of the recommendations from this survey, the Mental Health of Ottawa's Black Community Research Study, is the collection of race-based data as it relates to student absenteeism, suspension, and practice of academic streaming, which disproportionately affects racialized students. Does the school board currently have a plan in place to collect race-based data related to absenteeism and suspension? If not, to build on OCDSB's identity-based data, are there plans to collect this data in the near future?
Thank you very much, Adrian, and certainly I'm very pleased to be here to contribute. Yes, we have in fact released our first level of information coming out of the identity-based data project. The focus has been the key questions around what has been called streaming, and that is the movement of students into applied versus academic pathways, because of course that has an ultimate impact on outcomes as well as on discipline. So suspension and other exclusions because of discipline issue. We haven't identified attendance as a specific question to be answered by this go round at the with our identity-based data collection, but that is not to say that attendance is not an important part of looking not just at mental health, but overall engagement. And so there are a couple of things that I want to comment on in terms of the identity-based data collection, because it's really important for us to recognize that just by collecting the data doesn't answer all the questions, nor does it solve the problems. It helps us to set targets, and it helps us to understand where our challenges are. So one of the things we did before we actually started collecting the quantitative data is we went about getting qualitative information through working with some of our community partners and our community circles that are close to the ground and listening to the voices of our very diverse community. And we heard that we have not yet taken identity as important as we should. So identity matters is a key piece that came out of that qualitative piece. Data collection came out of that qualitative piece, and representation came out of that qualitative piece. So we actually have started working on that even in advance of receiving the identity-based data and the quantitative data. And we also know that the research that has gone ahead and other boards that have collected this data has indicated their patterns around streaming and around discipline and around attendance that we've already started working on. So as we expect to get our demographic breakdown for this information coming in the fall, we haven't waited for it because we've already started to put a strategic action plan in place to start addressing. Everyone knows that the cycle of school systems is a very elongated cycle. So for example, if we wanted to change on what was happening pertaining to streaming, pathways and selection of courses actually happens in January. And so if we waited till September to get this information and didn't start working on it, it would be 2 Septembers before we actually see changes in the classroom. So we're hoping that the information that we receive will augment what we already know, but we've already started planning with that. And it's important for me to say that because people will ask the question, so why aren't you collecting the demographic data around absenteeism? This is the first time Ottawa is really delving into the granular dissection of demographic patterns. And so we set some specific sections that we're working on to do them well. But what we've been doing is we've also been learning. And so the next part of this piece is how it is, because teachers see their students, how it is that the training and the work with teachers, guidance counselors, principals, will help them to identify their own patterns and concerns right on the ground when they notice that there are groups of students who are not coming in. And so it's not just a question of the big system identifying problems and solving it. The real solutions are actually in the granular delivery, the classrooms, the on the ground work with kids. And so we need to ensure that people understand data and understand what they're seeing and understand what their patterns are and have the skills to address them on the ground.
Camille Williams-Taylor, we know that revolution is not instant coffee, but we also know that change needs to happen, and you've indicated that you're committed to transforming to significant change within the OCDSP. What are the biggest barriers to change as you see it within your organization?
Well, the first one that comes to mind, Adrian, is time. We recognize that there are many competing priorities. And in a time like this, especially when we are dealing with an emergency situation, new initiatives, new learning, time for investment sometimes gets waylaid. And that's one of the things that we've had to do, is ensure that we don't allow other priorities to actually impede on this priority, because we recognize that it is probably more important that we put our attention to this. But the issue is time. And so the time to ensure that teachers, staff, principals, all our folks who are on the ground in schools, where the change is where change happens, that as they're learning about new protocols for getting kids into and out of school during a pandemic, that as they learn about new protocols to doing remote learning and in-class learning, that there's also the time invested to understand and to learn about what it is that they need to do to ensure that whatever the context of learning, that students are properly addressed around issues of anti-racism and anti-oppression, because they continue to be real despite whatever platform we're talking about. So, you know, it might sound pie in the sky, but I do always, you know, in this time of talking about budgets and money and all of that, I remind people that time is a resource. We have human resources, we have final resources, but time is a resource and it is finite. And so how it is that we decide our time in terms of the priorities that we have is important. So I imagine people anticipated a different answer, but I would say that, you know, I'm finding as a leader in this organization and in the conversations with my teams, that time is a challenge.
And as I did with Sheila James at the City of Ottawa, have you at the OCDSB established clear benchmarks which will allow people to judge or to determine what kind of progress you've made?
So yes, and I was listening as you were asking that question, and it is always the question that people want to ask because they want to quantify progress, right? And I would say to you that no, we haven't identified quantifiable targets at this point, because we have yet to see the quantitative data that puts us where that gives us a reality check of where we currently are. So it would be a bit preemptive to set targets when we haven't concluded what the benchmarks are. And in terms of staffing, we do know that one of the pieces that we're looking forward to is in fact starting to collect, to do a census on who our staff is and what the demographics are, so we can start to look at where we want to go. That said, however, accountability still matters. And so what we are releasing in the fall is a roadmap around our focuses on what we are committed to delivering. So the accountability piece in this first go round, the first phase of our work, is around, have we delivered on what we promised we would deliver? Have we trained staff? Have we set up affinity groups? Have we changed the key areas of the curriculum to be more representative? Because these are deliverables that are identified in the roadmap and will be shared. And they are deliverables where people, staff, students, community are able to actually see, well, you said you were going to do this, have you done it? Right? So those, from a point of view of target setting, those are the targets that I can say at this point in our first phase, we're saying that we are committed to moving towards. But from the point of view of, you know, how many students have now, what percentage of students have we shifted from going in one pathway to another? We won't be able to identify those targets yet until we have completed this first phase of our data collection.
Okay, Camille Williams-Taylor, thanks so much for that. I'd now like to move on to Councillor Rawlson King. First of all, Councillor King, congratulations on the city's hiring of the first anti-racism specialist. The mental health of Ottawa's Black community recommends workplaces implement anti-racism workplace policies, excuse me, and ensure staff have access to mandatory anti-racism training. Will this be an item that the anti-racism specialists can support or guide various city departments to achieve?
It absolutely will. So good morning, everybody, and it's great to be participating on this panel. But obviously that will be one of the focus of the anti-racism specialist and also the anti-racism secretariat in particular. And this is because really this is what the community called for. So in the first mini consultations that I undertook with the African, Caribbean, Black, and the wider racialized and religious communities in Ottawa, we heard specifically that they wanted a movement towards more training, looking at practices, different workplace practices. And so it will be very important that our new anti-racism specialists look at these areas and look at these areas in terms of reviewing the way that we do service delivery, the way that we bring city departments together and ensure that we coordinate so that we really change the culture. I think this is really what I believe Chief Sloly was getting to as well. Not just training, but also looking at the culture of the institution will be very important. But that will be part of the role of the specialist to really ensure that we continue to look at training for managers and employees, looking at really enhancing awareness and skill development in the area of diversity and inclusion in order to really foster more inclusive environments across the city and in workplaces. Because we're hearing from employees in the city that they do want more inclusionary workplaces, and we heard that very clearly from the community as well.
How do you change the culture, and what in the culture within the city of Ottawa needs to change?
I think it starts with leadership, and I think that there's been an open acknowledgement, whether it's been the mayor around the council table, senior leadership, that the workplace really does need to reflect the community itself. And so that starts at the top. I think that really starts with ensuring that we see more people from racialized communities, from the African, Caribbean, Black community in positions of leadership. I think that is really one of the driving components for cultural change. Because as the chief said, we can have all the training in different contexts throughout an organization. But if the organization isn't looking fundamentally at itself and figuring out ways of renewal, they don't have to be revolutionary, as you said, it can be evolutionary, but the key is that we are continuously looking at ensuring that there is greater inclusion and greater meaningful input into the way that organization really functions. And that can only really occur, I think, if we see some renewal at the top, if we see more people who really reflect the wider community making key decisions.
Is there evidence that representation matters? What is it?
I believe so.
But more than just thinking so, like what are the numbers tell us? That is there a way of proving that having more representation actually changes things?
I think it does, and I would use my personal example. I realize that's not a bureaucratic organizational example; it's a political example. But representation definitely does matter because with my election last year and a by-election, the community was elated because they saw the potential for somebody to provide real meaningful input and really advance meaningful change at the city of Ottawa. And so people were really elated in my ward. And then literally a month later, they were kind of deflated because of a racial incident of a hate crime within my ward. And the community came together and said, this is unfortunate. We experience these types of individual acts of racism, but what's not tolerable for a community is not having access to equal opportunities before their government. So it was the community that said, we want to see an anti-racism secretariat at the city of Ottawa. And because I was sitting around the table, it was possible for me to coordinate public consultation with the community, and then take those deliberations, create a proposal, and speak with the mayor, speak with my colleagues around the council table, and advance a proposal for an anti-racism office at the city, which went from ideation to really inception, when you think about it, in a very short time, under 8 months. So the reality is that we need people around the table, proposing change and really pushing change and ensuring the implementation of change. And that's why representation politically matters. And it also matters at the board levels at different organizations. So in a real way, I really emphasize to members of the racialized and Black communities that it's essential that we're around the table. When I'm talking to other organizations in the community and they're asking, what can we do? I tell them it's essential for us to have people in meaningful positions at board levels, at our agencies, in our departments, and committees who are making real decisions that matter.
Councillor King, we're all professionals here, but I'm sure I'm not the only one who's admiring your record collection. Is that your record collection? Because that's an impressive haul you have there.
It is, and it's very varied. Everything from Digital Underground to the Velvet Underground is in my collection behind
that.
Me.
Is impressive, and your analog as well. So that's very, very impressive. Well, no, thank you very much for that. We're going to move on to Dr. Etches right now. Dr. Etches, what do the findings of this study, of this report, mean to you, and what can organizations, including OPH, do to address in a very concrete way the recommendations of this study? Did Dr. Etches leave?
No, here.
Oh, she's there. Okay.
Again. Yeah.
You're admiring that record collection too, aren't you? You're just enthralled. You're transfixed.
Obviously, it means we have work to do, but it highlights that this is work across our whole community, across many sectors. It's beyond health. We know that the health of our population is determined by so many things. So this report highlights the employment, the financial aspects, but those are connected to education, right, and the opportunities for children. And so it really underlines for me the importance of the cross-sectoral work we do, the focus on children and youth. The community safety and well-being plan will be an opportunity, and that in that work, we need to look at approaches that focus on populations with greater needs. And so, I mean, that's across the whole community, across different sectors. When I think about Ottawa Public Health, there are very specific recommendations here about increasing our cultural competence, for sure. All of those things we need to do. The hiring also, often we think, well, we just don't have much opportunity to change that. But even in this COVID time, it's very clear we need more capacity to do case and contact management, to manage outbreaks. We need to connect with communities that have higher risk. And so we have taken steps through the Boys and Girls Club that is working in communities that are more predominantly African, Caribbean, and Black, where we see higher risk, to make sure that we are hiring youth from the communities and creating some economic opportunity, as well as implementing public health messaging and programming. And we'll continue to look for those opportunities to be more representative. It's good for the whole population when we address inequities. We know, this infectious disease idea is so prominent right now, but there are no boundaries to infection. We're a one whole connected community, and I think this is where it's underlining we need to look at equitable opportunities to promote health and protect health at the foundation, but long before we end up with infections. So I'm very excited about the process of this report that has included such community engagement, and for Ottawa Public Health, we're committed to that ongoing dialogue, so that we are following the lead of the community in implementing the recommendations, and understanding how we're doing. So this checking in, this trying to move targets, but the holding ourselves accountable, that is the way we'll be proceeding. Again, drawing on supports from leaders here. We have, the Anti-Racism Secretariat will be of assistance.
You alluded to the importance of enhancing cultural competency within your organization. Why is that important, and how do you do it?
Personally myself, I'm trying to read. I'm trying to look at the history of anti-Black racism in Canada. There's a lot of information that has not been taught in our schools. That people aren't clear about the slavery that's happened, and the way people have not had access to economic opportunities for centuries in Canada, and how that affects how people are viewed, and how that affects our health. That's all connected. So as health providers, we need to know more about that to inform our work. So there's reading, there's education. I think the most important thing that I have seen and learned from communities is that relationships are really key to building understanding and changing attitudes. So again, this partnership with community to work alongside is what's going to really change how we do our work. It's different if I'm sitting at home by myself reading a book. It's different if I'm sitting beside some of the people on this Zoom conference and working alongside and listening and thinking about, is this action going to make a difference? Do I need to consider something else? So I really appreciate, again, the support of the community, showing us what we need to do more, and being there to continue improving things.
Dr. Etches, I appreciate your candor and the fact that you were willing to talk about some of your own efforts. And if you'll allow me, if you'll indulge me, if I can ask, what's one thing that you know now, particularly with regard to the African Canadian, the Black community in Canada, that you didn't know a couple of months ago? And what have you learned, and how have you kind of put that learning into practice?
Yeah, it's a little, I mean, it's unfortunate, but I think I did have a sense that maybe there was a bit less racism in Canada compared to the United States, and I think, going right back to when people were trying to come to Canada to escape slavery and racism, to realize they actually encountered very similar attitudes and systems here, and that how people are viewed just because of the color of their skin has, from the early days, been a real detriment and disadvantage that isn't different this side of the border.
Okay, I appreciate that. Chief Sloly, can you tell us about the work that the OPS is doing and will do to support the mental health of citizens you come into contact with, and ensure the safety of individuals living with mental illness when they're in crisis and come in contact with the police?
Yeah, thank you, Adrian, appreciate it. I'm going to do a little bit of reading to prompt myself so I can stay on track here. First of all, I just want to recognize two very quick things. The researchers, and I hope I don't get the names wrong, but Hoden Aden referenced Dr. Kwame McKenzie of the Wellesley Institute. I've known Kwame going back over 15 years. I sat on the board of the Wellesley Institute when I was with Deloitte in my previous career. I use Kwame as an expert and the Wellesley Institute as a source of evidence-based research that underpins a lot of what I'm going to talk about in terms of advancing and accelerating operations, changing and evolving operations here to address the question you've asked. I also want to recognize that the other researcher, Chindu Oraka, and again, apologies if I'm not getting the pronunciation right, stated that a recommendation was that collaboration should take place between community and the police service, specifically the neighborhood resource teams, and that integrated service delivery, collaborative service delivery is, in his recommendation, the model for going forward. That is exactly what I have been trying to do for the majority of my police career. That is exactly the operational model that I presented to the board when I applied to be chief of police. That is exactly what I have been talking about literally every day since I've arrived here in Ottawa. We need to prevent more than we push into the justice system. We need to consider the social determinants of health and the underpinnings of crime as opposed to crime itself as our major target. If we can improve the social determinants of health, we'll reduce the incidence of crime. And if we take a prevention and integration approach around what we have to deal with crime, we're likely to put less into the justice system that will cause much less cost in terms of financial cost to the community and much less social cost to the community. It will produce value in a net if we can do that consistently and collaboratively over time. So my operating approach, not just to mental health issues, but to any public safety issue, is through a neighborhood policing strategy that puts a focus on officers in neighborhoods, working with community, for community, building trust with community, earning trust with community, identifying the community's problems and priorities, and focusing on them first and most, but in a collaborative way, not as a siloed service delivery model to address all those issues. Unfortunately, that has been the operating model for a long time, reactive, enforcement driven, where in a silo, we try to address a whole range of public safety issues, most of which we don't have the expertise or capacity to deal with. And even if we did, we couldn't adequately and effectively and sustainably deal with them as a police service alone in isolation from public health, public education, other city agencies, and of course the not-for-profit sector, and those who live and feel most the challenges of those public safety issues, the residents themselves. Neighborhood policing is built on that principle and those outcomes. Prevention and not enforcement is where we're going. I want to be clear. Neighborhood teams that were referenced by the researcher, Mr. Oraka, they will work in urban, suburban, and rural communities. Right now, we've deployed them exclusively in urban areas, but over the next 3 years, we'll deploy them into our suburban and rural areas. There'll be different models for the different communities. They'll be customized to those communities, and the customization will take place based on what the communities want, not from what we impose upon them. They will focus on prevention, decriminalization, diversion from the criminal system. The service delivery model will be integrated. We've already piloted that in some areas of the city, including Councillor King's area, in terms of the integrated service delivery teams, where social services workers from the city work alongside the neighborhood resource teams. It's early days, it's an immature model, but we're building capacity and it's based on real-time learning and evaluation. And we've brought in a third-party academic researcher to help us to do the evaluation, community engagement, and consultation to make sure that it's not just being determined by the police alone. And it'll be based on what goes into the system. We'll try to bring out of the system through diversion programs, pre-charge and post-charge. And ultimately, if a human being is in the system, is in custody, we have to focus on rehabilitation and restoration. And we'll lean very heavily on our Indigenous communities' experience around restoration as the model to move that forward. You asked specifically about mental health and mental health response. I have advocated for it at the national level, at the provincial level, and at the municipal level. Community safety and well-being plan led by General Manager Tony DeMonte, I believe is the key to enable that to happen. But there are other key elements. Right now, the Ottawa Police Service has a 8-hour-a-day, 5-day-a-week, 12-hour-a-day, 2-day-a-week program for joint mental health service delivery, where a police and a mental health practitioner respond to calls. We need to get that as quickly as we can to a 24/7, 365 capability. And I'm seeking provincial and federal funds to accelerate that process here in Ottawa. And ultimately, I will find my own operating funds to create that in partnership with the broader community. I've already started to have conversations with Dr. Etches and other healthcare providers to frame out how that will happen. And before we implement anything, we will go through a rigorous process with full partnership to design that program, not just to expand it to 24/7, 365, but to actually design, implement, evaluate, and continuously improve that program. A joint police and mental health practitioner program. Ultimately, this has to be 24/7, 365. So you have to have the call taking capability to receive a phone call at 3 o'clock in the morning on a Sunday evening. The police should be able to receive that, but then the triaging of that, who goes out, a police officer, a mental health worker, a social services worker, no police officer, that has to be done at source. And so we have to be able to combine what is currently a provincial 211 system, a municipal 311 system, and a police operated 911 system in order to get that 24/7, 365 integrated service. The technology and legislation exists right now, the capacity doesn't. And so we're going to need to be able to fix that within the next 2 to 3 years to really scale and sustain this over the course of time. Ultimately, one of the most important things for me is none of this will be done in isolation from the community. We've established a community equity group Community Equity Committee that represents broad stakeholders and demographics across the city, subject matter experts, academics, who are helping us to design, implement, and evaluate virtually every policy that we currently have and anything new coming into the organization. So direct community input, including access to our policies and, yes, our data, including, we have been collecting, one of the few police agencies that for years have been collecting race and demographic based data based on our work with the Ontario Human Rights Commission. And that will inform the types of policies and practices that we deliver, including our new mental health programs that will go out. Very early days. I know people want this fixed yesterday. They don't have time. There's a fierce urgency. They want to see it fixed all right now. It will take time. And I echo Camille's earlier comments. Time is a finite resource. And there's a number of major issues that we're facing in policing. Some of them have been expressed by my colleagues. We have to deal with COVID. We still have crime problems. We have internal challenges within the institution itself. And yes, we have to finally and sustainably address the issue of systemic racism, specifically anti-Black racism, and in this city, in the nation's capital, anti-Indigenous racism. But we're not going to fix it overnight. And people are going to have to elevate their level of trust and confidence. So I know that is a huge request given the very topic we're on today, but we have the leadership capability in the city on display right now. We have people in the city who are incredibly passionate and capable. We need to come together and to some degree, call a halt to the antagonism and allow the space and the time for us to actually work and accelerate some of these opportunities that are clearly here with us right now. But that's my commitment as the Chief of Police. That's the commitment of the Ottawa Police Service, to do better, to listen more, learn more, individually and institutionally, to do better and do more in a more collective model going forward, to integrate our service delivery and scale it so it's 24/365, and do that in an integrated model with other providers, particularly mental health practitioners and health practitioners, combined with our ability to provide a safe environment in which those practitioners can operate. That's not a full answer to your question, Adrian, but I hope it gives some indication of the scale and depth of commitment that we have around this.
Chief Sloly, you know more than anybody that your police service and policing in general is being scrutinized in ways that we haven't seen perhaps in your lifetime. Things are being questioned. There are many well-meaning people who care about this community, just like you care about this community, who would argue that the operating model that we have used to employ the police is fundamentally flawed, and that we ask too much of the police, that the police are actually doing things that they're incapable of doing, and that in fact what we need to be doing is we need to be taking police out of the mix when it comes to dealing with people who are suffering from mental health issues, or we need to be doing as much as we can to remove police. What do you say to those people? Are they wrong in thinking that perhaps we need to kind of imagine a different way, a fundamentally different way of dealing with folks with mental health issues?
Yeah, Adrian, let me just be very clear on that. There's nothing that you've said there that I disagree with. In fact, I'm on record nationally, provincially, and locally on all those points. In fact, most of the best police chiefs in North America are actually on record and aligned with those thoughts. We defunded the mental health institutions and much of the public health infrastructure in the 50s and 60s, and pushed people out of institution into community without funding community, not-for-profits, public health broadly, and certainly not the police to be able to handle that influx of people that were cared for in different environments and different institutions. That didn't work out particularly well for any community anywhere in this country, particularly here in this city. And so we put it on the police as one of the few 24/7, 365 service providers to take up that gap. And guess what? Exactly as you said, Adrian, we weren't trained and capable to do that, but we've done it for decades. And I think overall very well, but in some cases, tragically and unfortunately, we've failed. And so, yes, I'm all for other agencies funded and capable to step up into that 24/7, 365 capability. But simply shifting funds from one bucket to the other and expecting that capability to still be there is not going to happen. We will fail similarly spectacularly as we did back in the 50s and 60s. So what I am suggesting, what the legislation allows for, what the technology allows for, and what the partners around this table allow for, is that we consider how to transition through that, not a hard stop. This is not an either or. This is an and equation. And I listen, understand the frustration of people that want to say, I'm done with that model. I'm done with that model too. I've been advocating for change for this model, and I've been implementing that change. Never mind just advocating for it, but let's implement it. And I think that's where the danger is, that we go back to the failure of what we saw in the 50s and 60s and repeat the failure in the 2020s and going forward. So I'm a student of history. I understood what we did well and what we didn't do well in that context. I'm not intending to repeat the same failure. I have an institutional responsibility. I hold an office to keep 1 million souls in the city safe. It would be unsafe and unwise to do what many people are advocating for. And we have a community safety and well-being plan. It is well underway. It will allow for an overarching strategy, including resourcing and funding from the city to determine what is public safety in the city, how is it delivered across all the different institutions, agencies, including the not-for-profit sector, and representation of the demographic groups and issues-based groups that are affected most and first by those issues. They will have a meaningful input into the design, the delivery, and the continuous evaluation. The police are not leading that. We are at the table supporting it. It is enshrined in legislation. It can become enshrined in funding models going forward. And I'm all in favor of that. And most progressive police leaders recognize we should not be leading the charge on mental health and addictions anywhere in this country. But we need to create a system to allow that transition and not just rip something from one place and jam it into another place and expect that everything will be better and everything will be good and resolved. It will simply not happen.
Thank you for that. Camille Williams-Taylor, the Ottawa-Carleton District School Board, and you have, in your previous statement, acknowledged that racism and systemic barriers exist in our education system. What is the school board's policy on anti-racism capacity training and cultural awareness training for board members, teachers, and also counselors?
Sorry, I just had to unmute. So right now we're actually working on developing a more comprehensive human rights and equity policy. So that is underway as we speak. We do have joined us on our staff is a human rights and equity advisor who has a legal background and an international human rights background. And that was her first order of business. So she started with that work in June was when she began the process to develop that for our system. That said, as the policy is being developed on one hand, we've also, as I've referenced earlier, developed a strategy that is going to be unveiled in the fall. And that includes not only a regimen of training, but accountability for that training. So we've talked about, many school boards talk about having training for staff on anti-racism, anti-Black racism, anti-oppression. But one of the things that we've all talked about is a question of accountability. How do we know that you took the training? How do you know we have the training? And how do we know you've used the training? And so that is the difference that this strategy is going to come forward with, and not only for our academic staff, but also for our business staff, because we recognize that a lot of the decision-making that happens, it really falls into what your biases and sense of knowledge is about those biases. So it's one thing to put structures in place. It's another thing to operationalize those structures with the spirit and intent to which they were created. And that will come only with the appropriate training. So training has been identified, and you asked about all stakeholders and all participants. And so we actually have a very granular training model for our senior team. So that is me, as well as all of the superintendents. We're working with opportunities for our board of trustees, as well as our principals, our vice principals, our managers, and then into our classrooms with specific attention, not only to the instructional component, but when we think about our guidance counselors, who are people who interact with our community and our families around very key decision-making points. So we're looking at a very granular model around what that training looks like, but it certainly is comprehensive because we recognize appropriate training and understanding at the leadership level will inform the accountability, support, and development at all levels of the organization.
Is there evidence that the training matters? And I asked the same question to Chief Sloly. What's the evidence that you have that anti-racism training makes a difference when it comes to actual practices, changes of attitude, behavior? What's the evidence?
Well, again, I would have to be prepared with volumes to bring to you, but I can tell you from my professional experience and from my observation, from my visits to classrooms, from my work with students, just a conversation that I had in July with a parent and her son, who, it was interesting, the young man was able to identify the difference between his experience in one grade with one particular scenario with a teacher and another similar scenario, and how that teacher carried it out. It certainly demonstrated the difference in capacity in terms of how he felt in a similar situation, but in two different contexts. So in one context, the teacher clearly had very significant capacity, background, understanding, and managed the matter very, very well, leaving him very satisfied. In the other scenario, not. And so that is just a granular example, but I can say to you that I have seen that example repeated over and over again when we start to talk about what is the actual impact and patterns of outcomes. When I walk into classrooms, for example, I look at what is on the wall, who are the students that are engaged, who's there and who's not there, and what are they doing and what are they reading. If they're reading and looking at texts that I have from when I was in high school or when I was in elementary school, which is a very, very long time ago, I don't feel that that is representative and relevant for our students. And you see that on the face of engagement. When I attended the Black Student Forum this year digitally, last year in person, you heard students talking about their experiences, and they differentiate between the experiences they have in classrooms where there's high capacity of the leader in the classroom and the experiences they have when that is not present. So that is qualitative evidence from my point of view, but we could also go into some of the research documents. So one of the ones that I point to very frequently is the 2005 Early School Leavers document. It's a research project that was done in partnership with Sick Kids. And it talked about the impact of school as a protective factor and where it is that school is a protective factor. And when you read the voices of those students, they talk very specifically about how it is that their identities are recognized, people who have capacity, people who see the capacity in them, how they talk about them, and what either brought them back to school or kept them there, or the lack of that capacity that pushed them out. And in fact, some of these students come back to be master's students, PhD students at later times. But if you read that, it's an old document, it goes back to 2005. But when it is that I walk through classrooms and I walk through schools and I speak with students and I speak with families, the same things resonate. So when you ask about, does capacity matter? Does training matter? It absolutely does. Because when it is that we're able to say, you've been trained, you've been engaged, you have learned, now there is an accountability and expectation. When you know better, you do better. And so we can't expect people to, and teachers are professionals, ECEs are professionals, EAs are professionals. These are not people who we expect to just carry out their duties from the goodness of their hearts. They come with a professional cachet of information and knowledge and are expected to maintain that for the client, essentially, that they're serving. So yes, capacity matters, training matters, knowledge matters, and being current about what effective practices in terms of serving our students and community highly matters, and it does yield results.
You know, I'm pushing things now, and I know I probably won't be asked back as a result, but I did want to ask you one further question, Camille Williams-Taylor, and it's this, and I think it's one of the elephants in the room. The truth is that there are people within your organization, as there are people in every organization, that resist training, that regard training as being an imposition and see it as being burdensome, and you know, wonder why they're being made to go through this process. What do you see, or what have you been doing in your capacity as a leader of the Ottawa-Carleton District School Board to get more buy-in from those folks who would traditionally resist these kinds of initiatives?
Well, it's interesting the way you put it, Adrian. You asked a question about buy-in, and it might be a controversial statement to make, but I'm a little beyond buy-in. From my point of view, it is now about structural change and a delivery on that structural change. So I will go on my my usual conversation, for example, about English in high school. So one of the things that people, people who are not in education don't necessarily recognize, especially if you don't have children yourself, that all children require an English, a trajectory of English in every grade in high school in order to graduate from high school. The other piece is that students are not on a pathway to university if they do not have university level English in grade 12. And so that is a structural reality. And so from my point of view, when it is, I start to ask questions about, well, who's in the 4U English? That's what we call grade 12 English university. Who is in there? People start to shift in their seats, because if it is that we don't see boys there, and we don't see students of color, particularly Black students and Indigenous students there, those students are not on a pathway to a university degree. So my position at this point is, what is keeping students from that? Who's guiding them into a different place? And how are we changing that? So that's not a hearts and mind conversation. That is a practicality. How do our parents know that they actually have the choice to say, no, I reject your recommendation of the applied English in grade 9, and my child will be going into the academic English? Do our parents know that? And so as the leader of the organization, working with the superintendent team, the senior teams that are going into schools and classrooms, having them ask that question, having that accountability come back, let me see your class list. I will say that when I was on the ground working in families of schools, I asked for that. I asked for the syllabus. What are the English, what are the courses? What's the material that's being taught? Let me see the faces of the students who are going into this and that. Why is it this student? Why is it not that student? And really on a granular level, not asking about a change in hearts and minds. It's about practice. And it comes to the point now, I mean, I carry on about, the Stephen Lewis report from almost 30 years ago, where it is that people are saying exactly the same things today that they were then. So, if it's a hearts and mind conversation, that's nice. But I think at this point, it doesn't really matter where your heart and mind is. It's what is the service to our students looking like? And when I walk around and look at what is happening, it's a simple question as to, we have this expectation that this is happening and I don't see it. I'm coming back next week. All right. And so how it is again, not punitive, not accusatory, but this is the expectation. And so if it's not being met, I want to know why, right? And the community wants to know why, parents want to know why, and most importantly, our students want to know why, because they have no hesitation about asking me as the director of education, why is this not different? So that's, it's a little shift from the hearts and mind piece, but I can't ask people to do things if I haven't provided the opportunity for them to learn how. But once you've learned how, then there is an expectation for delivery.
Sheila, excuse me. Thank you for that, Camille Williams-Taylor. Sheila James, with unconscious bias awareness training, which is a strong point that came out in the report's workplace recommendations, can you speak to whether the city will look to address this? And are there other trainings that speak directly to improving cultural competency and eliminating anti-Black biases?
Yes. Can you hear me?
Yes.
Yes, thank you. I'm going to tell you about the city's training and the complement of training that we do offer staff and leadership. But before that, I think it's important to address what has been raised about training in this conversation. So the city is aware, first of all, that unconscious bias can play out in the workplace, but we also know that conscious, deliberate bias also exists in our workplace, our city, our world. A lot of people ask me, they say, well, the Employment Equity Act has been around for 25 years. Why aren't we there yet? And I have to respond by saying colonialism has been around for 500 years. And this legacy is deeply embedded, in our attitudinal prejudices, systemic barriers, it's in our systems, it's in our culture, the dominant culture, right? And so to address that, you know, we have to have a multifaceted approach. Training is one component, conversations are another, but also the structural change that my colleagues have been talking about. But one of the things we don't talk about when we talk about, you know, equity, diversity, inclusion, we talk about it as a social change. We talk about it as a political change. Very rarely do we talk about it as a spiritual change. And ultimately, it is really a disruptive, global, spiritual shift that has to happen so that we can really take apart the power structures, right, that create racism, sexism, ableism, and have that real empathy and understanding as human beings. So, you know, we've talked about, is training, you know, the be end all, what is it called? All in be end, whatever it's called. Sorry?
That one. I have trouble with that one too. Be
Yeah.
all end all.
Yes, thank you. And no, but it's also, we have to ask, what is the training like? Who is delivering it? Is the trainer, is the facilitator creating an environment where we can have honest conversations, where people can actually express their discomfort about racism or sexism or whatever it might be? Is there room to be honest, respectful, but not caught in this societal value of being polite, of being quiet, of being operational? Like, can we find a place where there can be constructive conflict? Because it's only through conflict that you actually learn and move. So I'm going to give you I believe in, well, I'd like to call it learning, you know, environments, opportunities to learn. So whether you call it training, unconscious bias, whatever, these are moments where you can shift. And I'm going to give you an example of a personal aha moment for me. So this is in the 90s, right after the Rodney King situation happened. Sophia Cook had been shot in Toronto. So this is Toronto, 1990s, and the Ontario government put into place a lot of programs for youth. And one of them was called Fresh Arts. And as part of this, there was a facilitator that came in to give, and most of we were training students, like students and youth, right? So Black, Indigenous, racialized, BIPOC, racialized students, BIPOC youth. And one of the things that happened is we brought in this facilitator to talk about homophobia, because, you know, people were talking about racism, but without that intersectional lens. And, you know, it's fine to be homophobic, but you know, the white people have to be accountable around race. So we brought in a facilitator, and he's a Black man, and, you know, really, really articulate, really, I'd say from the youth's point of view, very cool, right? Like, just, he looked great. He spoke their language. He knew their music. He knew the culture, right? And he came in and he talked about homophobia and heterosexism, and very open. And he heard all of this homophobic remarks within this thing. And he kind of, you know, talked really gently, but as a peer to them almost. And then at the end of the session, he came out as a gay man. And the room, you could see the room just like, you know, both in shock, but in almost like, I can't believe it. Like, can there actually be somebody who is like us, who is gay? And so, you know, that idea of, does representation matter? Like, when we talk about, it's important for representation at the board level, it's important, you know, in leadership and in every area, right? As frontline workers, when we're talking to mental health patients, that's so important for that empathy. But also in terms of the facilitation and delivering the training, I think representation is really important. However, having said that, you are the front line of getting the pushback, the resistance, Adrian, that you talked about. You know, people are not buying in. They are, they don't want to be there because this is mandatory. And I have, you know, my email box is really full, and, you know, I've got a grievance to deal with over here. So yes, mandatory is important because you know what, the training and the learning is as important to your job as, you know, answering your emails. So that has to be, I think that needs to be communicated by leadership. But I think if you set up that training properly in terms of, you know what, you don't have to be, you know, quote, I hate this word, but quote unquote, politically correct. You need to be able to say those things, but we're going to carve out an area or a way that you can say that isn't going to traumatize everyone else. So how do you set that up? I've also been in really interesting bias awareness trainings where, you know, they give you pictures of people, different people, and you write down what is your first reaction, and you have to be really honest, and then you share. And in one of these, there was a woman in a burqa, and a white woman put up her hand very tentatively, and she said, you know, my first impression is fear. And I'm like, oh, wow. Like, it took courage to say that. It was shocking for some people because, you know, some people wanted to jump on her and say, why would you be fear of this woman? You know, she's being oppressed, right? This is some of the dialogue that you get in the room without kind of, you know, talking about, well, maybe she has choice, there's agency, you know, you can't assume things. But that began the very difficult conversation of unpacking what our impressions are, what our assumptions are, what are our biases, right? And so there are good impacts of training, but they have to be done right. And knowing that it's a minefield because we come in with our biases. And then there's negative things about training where people just kind of say, these are the right words, this is the right stance, but it doesn't actually change behavior. People, you know, leave those trainings and they continue to exercise condescension or use their power. And I'm not meaning responsibility, because there is also the power related to responsibility and accountability, but simply their power and their status to put people down or to be racist, etc. So that's kind of the context I want to talk about our training. But yes, we do have training. And again, one of the most important things about training is that you take what you learn and it moves into conversations. If there are microaggressions and so on, they get addressed. There is a certain kind of accountability or unpacking of that and learning in those moments that makes the person who is on the receiving end of the microaggressions feel secure, but also for the person who did it to really understand why, and to learn and correct, right, that, not from a, you know, that, again, that quote unquote politically correct stance, but correct or adjust or change. So from the City of Ottawa, we have mandatory training for managers called Leading a Diverse Workforce. And this is, I really like this training because it is participatory, and it's really training managers, and some of them are new and have not managed, but it is training managers around human rights legislation, all of the different legislation around discrimination, anti-racism, accessibility, etc. And this is done in a participatory way. So we create these situations where racism, sexism, ableism can happen, and how is a manager going to intervene and change? So those are things that are really crucial, that it's hands-on and they can talk to their peers and come up with solutions. We also offer our internationally acclaimed Equity and Inclusion Lens training for all employees. And this was co-developed with the City of All Women Initiative. And what I really like about this is that it unpacks, you know, social location. So where do we hold power in our lives? Where do we hold social power? And how can that be exercised over others? And how do we understand that? And how is that different from individual power, right? So those are really important. Also talks about, you know, hidden biases, how to be an ally, right? Our city manager, Steve Kanalakis, has specifically asked for bias awareness training for leadership. And we are currently developing requests for proposals rolling out this fall to look at that. But in addition, we do have a lot of documents, a lot of, you know, for instance, our diversity snapshots that talks and features 11 minoritized groups in the city. And this gives context. And these were developed again with CAWI, a City for All Women initiative, but these were developed in consultation with these 11 communities. So they were able to say, how do we want to be described? What kind of context do we want to share? And this is a really important piece for anyone working at the city to kind of learn about difference, because we know that we have very siloed communities here in Ottawa. We have people who live their lives without socializing with racialized folks, without socializing with Jewish people, without socializing with Indigenous people. So and it takes effort to move out of those silos, but these snapshots give us a way into kind of, oh, here's some language, here's some context, here's the population groups, right? But also we've developed a bias awareness context brief, and this is really a document to be shared with hiring panels to raise awareness of bias before moving into those processes. And it's about all sorts of bias, because when you're hiring, it's not only racial bias, which is probably the most harmful, I would say, because we know, well, racial and gender bias, because we know that there has been violence, throughout history and currently that has been meted out because of race, because of gender. So yes, that is harmful on a scale that is different from things like confirmation bias. And I would put ableism in there too. So race, gender, and ableism, homophobia as well. But then there's other kind of biases like name bias that you're all well aware of, confirmation bias, things like that move into the interview space. So we have those things to read. But also what I really like is that these efforts to address biases are also embedded in kind of operational processes. So for instance, for every hiring committee, we have an interview checklist. And I am a great fan of checklists. Checklists have saved lives, in hospitals, but they also keep us aware. So in the checklist, there are things like, have you checked your bias? Are you aware? Be conscious of it, around your behaviors, about your attitudes. And even like for somebody who is running between meetings, moving into their interview, and they don't have time, they have to look at this and they have to sign off on these forms. And just having that in there embedded in an operational document is really important to remind people. But the main thing is to have the conversations, and the more people we have in the city that come from the different perspectives of being Indigenous, of being racialized, as being disabled, as being queer, as being women, as being gender diverse, the more people we have, then the more conversations side by side, colleague to colleague, that is really going to help in terms of our continuous improvement as a organization.
Thank you.
I just want to say one more thing about the pushback or the resistance to training and learning and developing, the conscious effort that we all have to make, right? Because we want people to, go and Google things if you need to, read books, especially now, about the Black Lives Matter, about the Truth and Reconciliation, all of these things, go out and read things. But one of the things I want to say that has worked when I've given training is when people are really resisting, is like find a point of empathy that they can relate to. And as we know, the city of Ottawa, 6,000 plus workers of all different, some of them are in the field. And so I'm giving training to people, in operations, operational staff. And one of the best, I guess, success stories for me anyway is there was somebody, a man, a white man who is working in operations, and he was quite resistant. And there was another man who also worked in operations there, and he started out as a custodian at the city, and he has moved, he has gotten some promotions through the city and is a supervisor now. And so we were talking about, racism and gender bias and so on. And so in order to talk to this man, I started to bring up the alignment of the labor movement with the alignment of anti-racism in Canada and the feminist movement and so on, and talking about it in a way of you know, like, we're not all born conscious. Like, even as a racialized person who faces racism or facing sexism, just because you face it doesn't mean you're going to become a feminist. You know, it doesn't mean you're going to become an anti-racism advocate, right? You need to unpack those things and consciously learn about it. And so we talked about that. I talked about the labor movement, how it was a conscious, you know, deliberate effort from working class people to be valued, right? And the other person who you know, the person who had moved up was able to be there and spoke from his experience about discrimination he felt and his empathy around you know, now his colleagues, his racialized colleagues, and seeing racism play out in the workplace. And I thought that was really wonderful, like peer-to-peer sharing and building that allyship across work, like the workforce, across levels, you know, in terms of status, across race, gender, age, sexual orientation, working class identity, etc. So yeah, and we all have biases. It's like ingrained in our neurosystems, right? And so I think the more that we own it, the better it is for all of us.
Okay, thank you, Sheila. It's 11:20, and we're rapidly running out of time, but I did want to pose one final question to Councillor King. The recommendations from this report, as we know, are comprehensive and far-reaching across multiple sectors. Racism and discrimination are indeed major themes within the report. The community recommends in the report that there be a follow-up meeting in 12 months from today to bring various sectors together to discuss what actions have been taken across sectors from within the report, specifically those related to anti-racism workplace policies and training. Councillor King, is this an item your office can support as the council liaison for anti-racism and ethnocultural relations initiatives?
Oh yes, we will definitely be supporting that, supporting more public consultation with stakeholders, ultimately to ensure, you know, that we are examining all elements of the report and ways to really advance policy prescriptions. That's one thing that I did hear when I did my own consultations around the establishment of an anti-racism secretariat, that there needs to be constant input from the community. The community wants to really outline the challenges and the problems that it's facing across the board. So not just obviously with mental health issues, but with a multitude of other issues, whether they're economic development or employment equity. And they want to ensure that the problems that they outline really align with the solutions that will be developed by the city. So it will be very important on all elements for us to ensure that we have a constant dialogue with the community so that we can move forward and establish that anti-racism strategy through the anti-racism office. So it won't just be on mental health, and there are a lot of elements here. You know, my expectation is that that these elements will be taken to the anti-racism specialists, that the city will be looking at all of these different elements and seeing ways to address them, but that we will be doing that in consultation with the community on an ongoing basis.
Okay. Well, thank you, Councillor King, for that. And thank you to all of our panelists. Thank you, Sheila James. Thank you, Camille Williams-Taylor. Thank you, Chief Peter Sloly. Thank you, Dr. Vera Etches. This has been a very dynamic session, many incisive comments made, very informative. So thank you for sharing your expertise and experience and thoughts with us. Thank you also to our audience for your participation. We'd like to encourage you to please follow the link on the screen to review the technical report, as well as a summary report and 2-page infographic. You can go to ottawapublichealth.ca/mental health report or santépubliqueottawa.ca/rapport and mental. Your feedback on the report is welcome and appreciated, and it can be found on the survey link. And thank you once again to all of the many organizations and individuals involved. And we're going to wish you a pleasant day. And I hope that, you know, all of you get a chance to listen to some music like the Councillor King is going to be listening to when we finish the session. So thank you very much, and we'll see you later.
Take care.
Take care.
Thank you.